Breaking the Wall of Biomarkers for OCD. Xena Serifova. Falling Walls Lab, Leuven.
We can all imagine to be obsessed with a frame that isn't hanging straight. And we all worry sometimes about whether we lock the door before we leave the house. And aren't we all a little triggered by a dirty toilet, for example? Well, for some people, these situations cause exhausting obsessions. And to get relief from feelings of stress and anxiety, they feel the need to perform time-consuming repetitive behaviors or compulsions, such as washing their hands over and over or obsessively checking things. Or they avoid triggering situations, which often means that they are not able to go to work, see family and friends, or even go outside. Well, these difficulties are exactly what people suffering from OCD encounter daily. Obsessive-compulsive disorder is an extremely disabling psychiatric disorder. And a major challenge for treatment choice and evaluation is the lack of objective assessment tools such as biomarkers. But their development is challenging, especially in the field of psychiatry, where diagnosis is mainly based on observation of clinical symptoms rather than biological tests. So my goal is to tackle this challenge by investigating new biomarkers to determine the presence and severity of OCD. To achieve this, I provoke symptoms in the lab by presenting OCD triggering versus neutral pictures. And I use various measures to objectively quantify the symptomatology. In particular, I assess the sensitivity of the brain towards these pictures by using the frequency tagging EEG method. And our lab has shown that this technique is even able to identify differences in the responses of people with and without autism to social and non-social cues. And here I apply this approach for the first time in an OCD population. The basic trick is that by presenting two different streams of pictures at two different speeds, electrical brainwaves are generated at the exact same frequencies of stimulation. And by recording these responses over the visual cortex, I can disentangle to what extent each stimulus category is processed. In addition, I assess where people are focusing via eye tracking, and I measure stress physiology via heart rate and skin conductance. These biomarkers may show us how a patient is doing and if their treatment is effective. And they may even help us in determining which treatment works best for which patient. This way, we can optimize treatment approaches and improve the quality of life of people suffering from OCD. My name is Xena, and it was my pleasure to present you my PhD project, or the Pinpointing Obsessive-Compulsive Symptom Severity Study. Thank you.